every day, all day, probably for the last year, we have been hearing about, not talking about, hearing about healthcare reform from the people it impacts most. That's you, that's members of your family, those are your neighbors, those are your friends. What I always hear from my boss is, as much as she would have preferred various options to be made available and not be removed because of blue dogs or, various religious groups that didn't want this or that, she would say to me, as I fumed and fussed, she said, look, I wanted all those things in those bills. I wanted to be able to vote for them, but I didn't get that option, and I am not going to vote against it because I didn't get that option. My choice now is to not let the perfect be the enemy of the goods. Using Medicare as an example, and I was just on the cutting edge of teething when Medicare was passed, as I'm sure you can tell. The bottom line is that Medicare did not pass, with everybody with their arms around it. The Republicans then didn't like it. They don't like it now. Medicare started out pretty bare bones. As I recall, LBJ refused to do anything with it until he got Medicaid in that package so that he would have something to move forward that covered a majority of people who needed coverage at that time, which was the poor and the elderly together. And over time, those programs grew to provide the breadth of benefits that people needed. And there's no telling me, and I think there's no telling you, that as a bill moves forward and is completed and agreed upon and rolls out over a period of years, that we're going to recognize the flaws, we're going to recognize the benefits, and we're going to make it better, because that's what we do.